Hello and a very good afternoon to all of those joining me live on the Facebook page of News9. I'm Neha. ICMR is planning to remove plasma therapy from COVID-19 treatment guidelines after an ICMR study found that it did not help in bringing down mortality among critically ill patients or slow the progression of COVID-19. Indian Council of Medical Research, commonly known as ICMR, Director General Professor Balram Bhargava said, "We have discussed this in the National Task Force and are discussing further now with the Joint Monitoring Group that this plasma therapy may be deleted from the national guidelines." That discussion is ongoing and more or less we are reaching towards that, quote unquote. ICMR had conducted a study across India to find out the role of plasma therapy. In fact, the largest trial on plasma therapy has been done in India with 464 patients in 39 hospitals and 350 doctors. This paper was accepted in the British Medical Journal and we have received the proof and it is going to appear very soon. It's a full paper with more than 10 pages of hardcore science talking about the role of plasma in curing COVID-19, quote unquote, Dr. Balram Bhargava. Now to speak about, of course, more on this, I have with me Dr. Vishal Rao, who's a senior oncologist at CG Hospital, Bengaluru. Thank you very much, Dr. Rao, first of all, for speaking to News9. My first question to you is, sir, would you say the removal of plasma therapy from COVID-19 treatment guidelines is a step in the right direction?
See, what I would like to reiterate is we are running on a very thin thread of evidence today, and the natural search has been for looking at evidence-based guidelines to look at adequately treating patients of COVID-19. The primary aim that every single physician, hospital or regulatory bodies, advisory bodies are doing is to see how can we help save lives. And at this juncture, unfortunately, there doesn't seem to be one single magic bullet for corona, for the COVID-19 pandemic. There doesn't seem to be. The closest one that came to evidence has been plasma therapy that has been used earlier in several pandemics such as the H1N1, the Ebola and others, and something that the WHO has stood with over these last decades. The question comes is, what we know today is the fatality rate is at about 2% or 3%, looking at various states. What can we do to reduce these ICU-related deaths? What can we do to save these lives of comorbid patients? And that's the question that we are all asking as physicians. And at this juncture, there does not seem to be anything other than plasma that is working. Now, the evidence that comes from global literature, whether it's the Mayo Clinic study, whether it's some other 13 odd papers that come, including a meta-analysis, shows that there is definitely some benefit that we are seeing from plasma therapy. Mayo Clinic has completed its study on more than 55,000 patients, and I think as of now, they must have touched about more than 80,000 patients. The question is, US FDA has authorized it. There are globally no other tangible solutions to critically and severe patients at this juncture, and plasma therapy doesn't seem to have any harm. It is scientifically sound to use the antibodies from one patient to another patient. The ICMR study that was done showed that there was not much use, but it had one serious shortcoming which I would like to talk about, that the patients whose antibodies were taken as donors were patients with very mild infections in whom we know in most of the times there will not be much of antibodies. So considering the fact that this was given from donors who did not have strong antibodies to patients who were in the moderate illnesses would itself weaken the stand of the study to say that it's too early to say that it is not efficacious, because the denominator that we use in plasma is antibodies. Without antibodies, plasma is definitely
So are you saying that we have not carried out the study properly?
I'm saying that in the current situation, when they looked at a multicentric study, they have in their own paper acknowledged the fact that this particular study had these particular weaknesses, because it was done at a particular point in time when the pandemic was raging, when all the participating sites had various protocols that they have followed stringently, but yet had certain amount of weaknesses in the system, which means antibody testing was not available. We couldn't do neutralizing antibody test. And today, over the last 3 to 6 months, we've evolved a lot in our understanding of this pandemic. And so naturally the intent of this trial was to look at giving some quick evidence. But in this case, I would say the absence of evidence does not mean evidence of absence.
So are you saying that it
This
is
is very
time to
important.
give plasma therapy a second chance?
We need to, based on global evidence. We need to, based on global evidence. Otherwise, today I'm asking all of us today as collective physicians, when I see my own family members in the ICU, breathless, would I tell them and show a paper and say, look, I'm not going to try anything, and at this juncture I have no other weapons with me, so please keep praying and keep using oxygen? Would not be a right approach. I mean, I'm saying from a humanitarian perspective, today we know. I'm looking at today at HCG, the plasma bank has given close to 900 plasmas, and we are enthusiastically digging our data to look at what has been the responders. We've been personally talking to patients who have been recovering, which includes senior politicians, policymakers, which includes medical care doctors who have recovered after the plasma, and asking them how did it feel, what are the things that happened. More importantly, global evidences show that antibodies, when you check it rightfully, so the US FDA has approved the withdrawals assay platform to look at how good antibodies are. And at HCG, what we are doing is we are tightly looking at the quality of these antibodies, measuring the antibodies, and then giving these plasma to ensure that the most optimal outcomes are achieved and we are saving lives. And I think this is an earnest attempt that we need to continue to do at this juncture. And I would say, yes, we need to closely scrutinize, we need to improvise our science and understanding of it so that we cater to the patients in a more effective manner. But this is not the time to drop plasma.
Dr. Rao, given that we do not have any set treatment for COVID at this point in time, if therapies like plasma do not continue, what other options do we really have?
We do not have. And that's the primary worry I am having at this point, that if it was my family member, if it was my parents who were involved in this particular pandemic and who would be in the ICU, would I try plasma or no? The answer would be definitely yes, I would try it, because that's the only ray of hope I have currently, other than steroids, other than plasma and remdesivir, which is being again talked about that it is not efficacious. We do not have anything else. And I would say, go a step further and say, here in plasma, it does not have a pharma backing. It doesn't have an industry. And that's why you will see that it's more of an orphan medicine that currently needs guidance of physicians to handhold it and give the best possible evidence to this particular study, which is what global data is collating with more than 13-14 studies world over that have been quoted to say that it has got no harm, it reduces ICU stay, which has also been quoted in the ICMR study. It clearly showed that there was no improvement in survival, but it did not show harm. It showed that there was a reduced hospitalized stay. It showed that there was reduced ventilator dependence. Mortality was one thing it did not show, but a few studies have definitely pointed out on reduction in mortality, which needs to be dug into. But what I'm importantly saying is, it's important to look at interventions of plasma earlier. It is important to look at understanding that even if it is reducing the hospital stay, you will be having more beds available. Karnataka today, for example, has about 900 odd patients in the ICUs. We do not have more amount of ICU beds. The system is overwhelmed. The current system with intensive care is already overwhelmed. So it is prudent that we look at how can we unburden ICUs. How can we shift the game towards wards or home and not towards ICUs and ventilators?
Lastly, Doctor, I'd like to ask you, what about the infrastructure that we might have already set up? Funds may have been already set aside. If plasma therapy were to be removed, how best to utilize all these resources?
I think the current focus is simply on oxygen, ICUs, ventilators, and plasma seems to be a very simple, cost-effective option at this juncture. And I'm happy to say that the state government of Karnataka and the Rajiv Gandhi University of Health Sciences has collated a very detailed guidelines on how to use plasma. The Karnataka government has set up a plasma committee on how to ethically and in a systematic way deliver and dispatch plasma. How do we collect plasma? There's a very strict guidelines that is maintained, which is in accordance with any global guidelines that has been offered. And at this juncture, it is very, very
But
crucial.
what do we do with all of that in case plasma therapy is discarded?
I would like to reiterate again that in the guidelines, the Drug Controller General of India has clearly given it the permission of an off-the-label use, which means that while guidelines say that this may or may not be, it's a recommendation. Whereas the Drug Controller General of India would require to, who has already permitted it to be in the off-the-label use, it will continue to be used.
So
in the
Karnataka will
setting.
continue using it. Is that what you're saying?
Yes, yes.
All right. All right. Many thanks, Dr. Vishal Rao, for joining us with all of those valuable inputs. Well, there you heard the doctor. Although ICMR has hinted that in fact, beg your pardon, that plasma therapy may be discarded, but Dr. Rao says this is certainly not the step in a right direction. Thank you very much for joining me. If at all you like this video, do not forget to subscribe Newsline YouTube. Like us on Newsline Instagram, Facebook, as well as Twitter. Stay safe. Keep those masks on.